Sorry, Cole.
We are live, Kathy.
Oh, we are live. Okay. Hi, everybody. Hi, I'm Kathy Fray, and welcome along to this pissy little mini live that we're talking today about integrative maternity healthcare. If you're wondering what my accent is, I'm a Kiwi, a New Zealander. And quite often we get a little confused with Australians, but they sound quite different because Australians have got a much more twang to their voice. And I don't know, it's probably Kiwis, I think, perhaps sound a little British sometimes. But anyway, welcome along. And I've been a midwife here in New Zealand for quite some time. And I'm also a maternity author. And in fact, my book, Oh Baby, has been the New Zealand's #1 best-selling birth baby motherhood book since 2005. But these days, I don't caseload anymore. I'm not a 24/7 on-call midwife anymore, but I am sort of involved quite a lot in the international community of maternity sort of general discussions. And one of the areas that is an absolute personal passion is integrative maternity healthcare, also known as perinatal integrative medicine. So that's what we're going to sort of talk about today. I think, Cole, you may have some questions. I can't see anything coming up. Might be because I'm sharing the screen, but look, that's okay. I'm just gonna go through this, and this is a really a little miniature version of a lot more detailed information that I'm going to go through with the PC Obstetric Summit that is coming up in March. So do definitely look at participating in that if you're anything whatsoever to do with maternity healthcare. So integrative medicine is something that is a term that most of us hear of these days and know what that is. So integrative medicine is really that sort of modern healing orientated medicine which takes account of the whole person. So it includes all aspects of their lifestyle. Whereas within sort of modern allopathic medicine, we've got so much specialization within specialization within specializations that often doctors are really only knowledgeable on a very limited sort of area. So they're an absolute expert on something quite narrow, whereas integrative medicine always has a far more sort of holistic approach. So it's more embraces lifestyle, personality, health concerns, etc., because it's very much that philosophy that one impacts the other. So that evidence is in integrative medicine is that sort of therapeutic relationship between the practitioner and the patient, and it's informed by evidence, makes use of all appropriate therapies. And at its root foundation, IM or integrative medicine really incorporates the use of both old traditional modalities and new holistic therapies alongside modern medical treatments. So it's the whole thing. All right. So what the heck is PIM? What's perinatal integrative medicine? Well, that's simply the maternal, fetal, neonatal subspecialty of integrative medicine. So it's also known as integrative maternity healthcare, or as I say, PIM, perinatal integrative medicine. Because when a woman is pregnant, she is not necessarily of ill health or poor health, but she is not of her normal health. Right? I mean, by the time a woman gets into the third trimester, heck, her cardiac output is 1.5 times a non-pregnant her. Her renal filtration is 1.5 times a non-pregnant her. So her body is having stress factors put onto it. That it's not, so that's where we say she's not necessarily of ill health or poor health, but she could be a very healthy pregnant woman, but she's not of her normal health. And that's why PIM, or perinatal integrative medicine, is a specialty within integrative medicine. And oftentimes you will come across naturopathic, holistic therapists. They might be a medical herbalist of Ayurvedic medicine, or traditional Chinese medicine, or European medical herbalism. It doesn't really matter, but they have somewhere along the way in the course of their practice ended up specializing in maternity, so ending up specializing in topics like fertility, infertility, subfertility, pregnancy wellness, labor and birth preparation, and that postpartum period of a neonate. And so a newborn is really just that first 5 or 6 weeks after a baby is born. It's a newborn. By the time it's 6 weeks old, it's no longer a newborn, it's just a baby, as such. But the needs of a baby that's 2 or 3 or 4 or 5, 6 months old is still very different from the needs of a baby who's 3 days old. So again, it's that specialization, that there's that maternity specialization of topics around the perinatal period. Okay, so that's PIM. So again, it's when I was a founding director of IMCO, which is the International Integrative Maternity Healthcare Organization, and we have really stepped up as global thought leaders on PIM, on perinatal integrative medicine, and so we created a definition of what PIM is, because these whole terms didn't even exist before IMCO was created. So before the founding of IMCO, there was no term for what do you call integrative medicine that relates to the maternity journey. Well, there wasn't a term for it, so which is kind of crazy now because these terms have become fairly well known. So the definition of PIM is when the medical and the holistic, the modern and the traditional, the allopathic and the naturopathic all respect how they complement each other to intentionally form a united revolution of cohesive evolution to create the ultimate and best maternity care. Okay, so we've got some old terms to say. This is just a little overview today. And we deep dive a lot further into this. But basically, the terms you may be familiar with is CAMS, which is stands for complementary and alternative medicines, and also T and CMs, which is traditional complementary medicines. And within those areas, there's really 5 sort of subcategories of those. And that's firstly traditional medicines, which are things like homeopathy, medical herbalism, essential oils, traditional Chinese medicine, Indian Ayurvedic medicine. The second one is mind-body connection, so things like meditation, spiritual healing, neuro-linguistic programming, music, dance, mindfulness, etc. And the third is biological nourishment, so things like diet, vitamins, minerals, supplements, because believe it or not, even minerals and supplements are regarded as outside of modern medicine and go into the category of integrative medicine, which is kind of nuts. But anyway, fourth area, body manipulation. So things like chiropractic, osteopathy, kinesiology, and then finally energy healing. So practices like Reiki, Qigong, pulsed electromagnetic fields, etc. And a lot of the times these sort of interact and interconnect, and quite often you will have a therapist who is trained in more than one of these modalities, which they use all together. So the main modalities that are commonly popular within maternity wellness healthcare are these ones listed here. So I won't go through them all, but you can read the screen. Those, I mean, there are others, but those are the commonest ones that are used. And part of the course that you would do if you were participating in the full course with PC in this upcoming obstetric summit is that you will receive a copy of our guide called Oh Mama, which is a guide for birth practitioners and other maternity wellness clinicians through a lot of these therapies and a lot of individual specific remedies that one can use for particular issues. So the area that you can use integrative maternity healthcare is basically the entire journey across the whole maternity spectrum. So that's from preconception healthcare, fertility, pregnancy, common minor discomforts of pregnancy, and as support to pathological diseases which are part of pregnancy complications. So things like preeclamptic toxemia, gestational diabetes, etc. So these are not cures for them; they are support for those. And then a very, very important childbirth preparation. So particularly ripening the cervix prior to the woman going into labour. Big deals there. It makes huge differences to outcomes. And then there's lots of lovely little remedies that can be used through labour, through birth, after birth. So, to do with helping the placenta release and things like that. And then a lot of support for childbirth complexities and obstetric complications. So again, they're not cures, but they're support to those other treatments being used. Things like recoveries from instrumental deliveries, C-section deliveries, etc. And then, of course, postpartum period of both the maternal well-being and the neonatal well-being. Again, oftentimes the natural product can be the cure for something more minor, but for something more serious, we would look at it as being supportive to whatever modern pediatrics or obstetrics is doing. So this is just a slide of some of the more popular things that PIM does support in pregnancy, and you can read through that watching this live again. And then some of the more common things through labour and birth, and the complex issues through labour and birth that perinatal integrative medicine can assist with. And then maternal well-being in the postpartum and neonatal well-being in that postpartum as well. So lots of really great therapies that can be of huge support. Also, one of the things that we will be discussing in the upcoming course is the IMCO's PIM-friendly certification. So as well as being able to complete the course through PESI, this will give you access to, basically doing that course will give you you'll get this complimentary as such, because the course that we're doing on PESI is actually even more of a deep dive than this PIM-friendly certification, which is free and available. So you'll really receive that access to that free of charge, and it simply gives you a logo that you can add to your own website or business cards, Facebook page, etc., which says that you are a PIM-friendly certified practitioner. And it's not saying that you know everything and that you're a fully qualified I'll just get out of this. It's not saying that you're a fully qualified technician and everything, but it does mean that you are saying that you are open to it. You have an open mind on this topic, and that's what that is all about. Is getting more knowledgeable about being able to encourage a woman to get the benefits from not just modern allopathic obstetrics, but also often modern and traditional therapies as well. So look, that's just a little live overview, and hopefully that has been kind of useful to a lot of you. Yeah, so I don't have anything more to add. So look, we'll wind up that live, and I just want to wish everybody a lovely rest of their day. And yeah, okay. So, somebody said here, what natural foods help with lactation? Tune into the course and you'll get a free download of the book, and we'll be going over things like that as well. Okay.